Hello, I'm Dr. Mercy Paul. I'm working as a professor in the Department of Dermatology, Jubilee Mission Medical College, Trichy, Kerala. I'm going to talk to you on fungal infections of the skin. What is a fungal infection? It is invasion of the host tissue by fungus is called as fungal infections. Let's have a look at the different types of fungal infections. We have the superficial fungal infections, the deep fungal infections, as well as systemic fungal infection. Fungal infections are also called as mycosis. Now, coming to the superficial fungal infections, in these infections, the fungi invades the outer layers of the skin as well as the hair and the nails. There are mainly three types of superficial fungal infections. They are the dermatophytosis or the ringworm infection, which includes the jock itch and the athlete's foot. Then you have the candidal infection or the yeast infections, which can involve the folds of the body and the moist areas of the body. And in humid climates, you have one more infection, that is the malassezia infection. Now, the deep fungal infections include the sporotrichosis, chromoblastomycosis, and the mycetomas. And the systemic fungal infections, you have histoplasmosis and coccidioidomycosis. Now, where do we get these fungus from? Fungi are present in the soil, in human beings, as well as in animals. Deep fungal infections, the spores are seen in the soil and in the rotting vegetation. They gain entry to the human body by injury, or they get inoculated into the skin and they multiply over there, producing the deep fungal infections. The systemic fungal infection, the spores enter the body through the breathing and they lodge in the lungs, and these spores come from the soil or the rotting vegetation. Or you can also get these systemic fungal infections as opportunistic infections in an immunocompromised individual. Now, let us take the superficial infections by one. Coming to the most common, these are the superficial fungal infections. They include the dermatophytosis or the ringworm infection. Then the second, you have the candida, and the third, in the humid climates, you have the malassezia infection. Now, the ringworm infection what are the symptoms? Let's go to the symptoms of ringworm infection. It starts as a red, itchy patch, usually on the sweaty areas of the body. This increases outwards and the central part of it starts healing. That's why it's called a ringworm. Just like a ring, the central part is clear and the periphery, then the outer part becomes thick. The outer part spreads bigger and bigger. At the same time, you can develop new lesions in the body. Now, this can involve the scalp, from the scalp to the feet, anywhere on the body. In the scalp, it can produce loss of hair, patchy loss of hair, dandruff-like condition, and sometimes swellings. It can involve the hair on the face, like the beard area, the mustache area. And commonly, the most common presentation of dermatophytosis or ringworm is a jock itch. It can involve lesions anywhere on the body, including the web spaces of the fingers and toes, and also the palms and soles. Patient presents with severe itching and redness, red rashes, which is gradually increasing in size. Coming to the other superficial infection, that is the yeast or the candidal infection, they are usually seen in the folds of the body where the body is warm and moist. They keep spreading, and you can see smaller lesions at the side which grows into bigger ones. This candidal infection can also involve the oral cavity or the mouth, producing an oral thrush. It can involve the private parts of the genital areas, and in the females, it can produce itching and a curdy discharge. In the males, it can produce itching of the private parts. Then the patient usually presents with a itchy lesion or a genital discharge. Now, what are the predisposing factors for these fungal infections? The most common cause for a fungal infection is a poor personal hygiene. Other things include obesity, where your folds become warmer and humid. So the fungi prefers those areas which are warm and moist and invades the fungus and invades the body. So obesity is an important factor. Then you have the tight-fitting clothes, which prevents air entry. So again, the skin becomes moist and warm, and the fungus can easily invade. Then diabetes mellitus. That is, diabetes mellitus invariably decreases the immunity of the body, and predisposes the body for fungal infection. Then shoes, wearing of shoes for a constant period of time, especially in the humid climates, again predisposes warmth and moisture between the toes and the feet, and they're prone for both dermatophytosis, the ringworm, as well as the candida. Then patients who are on immunosuppressive drugs for various ailments like organ transplants or any other many serious diseases where the patient is put on immunosuppressants, they're again prone for fungal infections because the body cannot fight against the fungus. Now, how are we going to treat these fungal infections? First of all, we must take care of these predisposing factors, so personal hygiene is a must. You should take bath at least twice a day and change your clothes every day, and never share your personal belongings with others, because somebody is having an infection, you can get it even a household. Family members, one of them having a fungal infection, you can easily get it to the other members by sharing your personal articles. Then secondly, for treating the fungal infection, always go to a dermatologist or a doctor, preferably a dermatologist. Never buy medicines over the counter. Over the counter medicines contains corticosteroids along with antifungal and antibiotics, and this is initially going to decrease your itching, but the fungus is going to spread like a wildfire. So in the end, your body is not going to respond to the usual dose of antifungal that is given. Now, this has become a real menace in India, where many people go to the medical shops and take these combination drugs and apply it, so they get temporary relief for some time, but in the long run, they're really going to suffer with extensive fungal disease. Okay. Now, second thing you do about treatment fungal infection is always complete your treatment. If you take treatment for a period of time and you're symptom free, never stop. You complete the total duration of the treatment, and only when your doctor says you stop the treatment, you stop it. Now, coming to the footwears, never share your footwears, and always wear some footwear which is little airy, or if you have to wear shoes for long periods, at least in between you give for a few minutes, you just take off your shoes so that you can aerate your feet. And another thing is decrease your weight and keep very good personal hygiene. Your clothing, preferably wear cotton clothes in the warm, humid climates. All these can prevent you from getting a fungal infections. And overall, you have to be careful of your personal hygiene, which is the most important of all. Thank you.